What's going on? Welcome back to the channel. My name's Anas. I'm a fourth year medical student studying in London, and today's video is just going to be a chill kind of video where I sit down and I react to some medical school slash medical memes. So I found this video on YouTube which has 1.2 million views, and apparently these are the best kind of medicine memes. A few people have already made this video, so like Dr. Mike, Dr. Hope, I think, so shout out to those guys. Before that, if you don't follow me on Instagram, it will be on here. Make sure you go follow me on that. Let's go. So the doctor says, "What's your zodiac sign?" And the woman says, "Cancer." Doctor: "Oh, what a coincidence." Oh my days, this one isn't even that funny. It's not even that funny, but so like basically in medical school we're taught, like part of the curriculum is that we're taught how to break bad news and communication skills and all of that stuff. So obviously it's not really done like this. But the other funny thing is that if you just look at the doctor, he's just sitting there like laughing and she's laughing. It just looks weird. It's like, okay, let's go into OSCE mode, alright? I've got some really bad news to tell you, okay? That's usually how you do it. But then you go, I've got some really bad news to tell you. Next one, my anatomy exam, and it's just showing a bunch of spaghetti and that. Identify this nerve. Okay, yeah, so the way we kind of examined anatomy, I don't know how they do it every year, but for us anyway, we've got something called an OSP. Yeah, so OSP, where you go in to the anatomy dissection room, and you've got all of these pro-sections of like different parts of the body, and they might put a pin in an area that you need to identify. So it might be a nerve, and actually if you haven't studied, that is literally what it looks like, but it will be like different colors. So some of them will be like a bit darker, some will be like a bit lighter and stuff, and it's just like bang, just identify this. You're just like, what the hell, how am I supposed to know what this is? Tells you to get there 15 minutes early, and then the doctor is 50 minutes late to your appointment. So with this one, I used to actually work in a GP back in the day, so I know exactly how this one works. So for patients coming into the practice, they only allow like a 10-minute window. If you're more than 10 minutes late, then you don't get to like have your appointment on that day. And that is to do with a few issues. One of the issues is that all the appointments are only 10-minute slots. So if I get into the practice 10 minutes late, then that means that my appointment has overrun, and therefore I'm gonna like overrun into like other people's appointments. But the other thing is that 10 minutes isn't really enough to kind of go through some of the complex issues that some of the patients have. So I'm the doctor and it's my clinic, okay? And then I get an elderly patient in, and she's got loads of like, she's got diabetes, she's got back pain, she's got like a hip replacement, whatever, and I need to go through all of those things. So if you're there and you're the patient and you're coming another like 20 minutes late, then that means I'm gonna overrun another 20 minutes, and then we're just gonna keep going like that. I could probably go into midnight. Yeah, and sometimes as the receptionist where I used to work, like say the practice closed at 7, I had to stay until like 10, just because like the clinic is overrunning with either people running late or the doctor like having to see all of these complex patients. But let's not get it twisted. Yeah, some doctors actually take really long to get through their appointments. But yeah, I hope that gives the lowdown of that one. How I felt when I was in high school. How I feel when I was with this one. Basically, I mean, everyone feels really smart when they're in like secondary school and sixth form, because yeah, you're getting all the A's and A stars and that, and then you come into med school and then suddenly you get like average grades all the time. It's pretty sad actually. You can still do well, like, ain't that deep. Nah. So when you have a date right after surgery, so it looks like one of the surgeons is wearing. Nah, that is actually mad. Okay, so I don't know if any of you guys have actually been into theatre, like standing in. So it's in the operating room, like standing there for like a 3 or 4 hour operation is difficult. Like, not you like you get back pain, your legs are like so. This is what you look like, yeah. Okay, let's see if you can actually see me. And you're like, yeah, and then you start twisting, and then you do that. There are these ones, so you like start cracking your back, and then you start moving and it's like, okay, massaging your leg and that. Okay, it's not that easy, all right. But it looks like this surgeon is like wearing high heels, which is mad. Like, how is that? Doctor, looks like you don't have any health insurance, so we're gonna let you die. I mean, okay, fantastic, thank you. Yo, this. Oh, like it's not even that funny, but it's just like the sarcasm, and they're like smiling as well. Like, oh, great, yeah. So okay, so doctor, it looks like you're pregnant. Patient, what the hell? But I'm male. Doctor, I said it looks. Yo, and now that's a violation now. Okay, so the doctor says your case is quite complicated. Why, doctor? What happened? You got a disease from the chapter which I left. Okay, yeah. So any medical student knows this, and at least most people do this. Is that when there is anything optional that comes through your way, optional equals I'm not gonna do. Like, if there's any section that's optional, I don't know if I'm gonna attend it. If there's any content that you need to do, you need to cover, but it's optional, like, So when you've forgotten all about the outside world after a 16-hour shift, what kind of bird is this? All right, so this one, okay, forget about the shift because we haven't started working yet. Medical student perspective, but my uni is just like it's a healthcare specialist university. So there are only students there who study healthcare related subjects. Okay, so I don't interact with any art students, any history students. Literally, the only thing you talk about is how's placement going. Oh, which consultant are you with? What do you have next? Have you done this essay? You're prepping for exams, whatever. That is literally all of our conversations. We never get into like any discussions about politics, any discussions about, like, you know what? The only news I get is from Facebook and Instagram. I don't know if that's just me. Sometimes like I'll get home and someone will tell me, oh, have you heard that this happened? It's like, nah, I don't really hear it. So the guy says, well, you see, doc, the problem is obesity runs in my family. And the doctor says, no, the problem is nobody runs in your family. That is an utter violation. That is like, I don't know, why are all these memes about like obesity and stuff? Obesity is like a general health problem, but like, that's just a bit deep. I see that one. I see that. I see it. Essentially what they're trying to say is, like, the guy is pretty hench. He's made all kinds of gains. You can see the bicep, you can see the vascularity, and obviously what they're gonna say is that, like, he's hench and that, yeah. But also that, like, nurses will find it easy to, like, take bloods because there's all kinds of veins, all kinds of gains, oh my days, all kinds of gains, all kinds of veins. Damn, I'm a poet out here. You know what? That literally just came to me right now. It came to me right now. Australia has got bloke, and then you've got man in America, cyclone, and then you've got hurricane, lift, elevator, shopping center, mall, universal healthcare, and then there's nothing there for the US. What's going on, my US people, with private healthcare? This wasn't that funny. So medical students watching surgery for the first time. You can see all the kittens there. They're just like, trying to look in what's going on. Sometimes it looks like that. Most of the time it doesn't really look like that. So I think this is like supposed to be a point of view. So wherever the surgery is happening, you're kind of looking over like that. Yeah. In reality, you don't really get to go that close. Like, so usually what happens is surgery is going on here. The doctors or the surgeons, they're here doing their little vascular surgery, okay? And you, as the medical student, you're like here, okay? In reality, you don't really know what's going on. Like, you don't know exactly what structure is being cut. You don't really know the names of the equipment. Maybe later, like maybe fourth year, fifth year you do, but before that you don't. And you're just like pretending like you know what's going on. Pretending like you can see what's going on. So sometimes it looks like this. I mean, it would be good if it was like that. Most of the time, you're just like a side man. All right, I think that's I think that's all the memes that I have for today. I hope you enjoyed that video, that like spontaneous thing. If you like the video, then like the video, comment, like, subscribe to the channel. Safe.